Today we are going to review the use of the 1112 and 17 Explorer. First we will start with the 1112 Explorer. You determine the correct end of the 1112 for the posteriors just as you would for any universal instrument. Use a modified pen grasp and fulcrum close to the working end. Place the instrument on the distal surface and look for the terminal shank to be parallel to the distal surface. The functional shank goes up and over the tooth. If you have the wrong end, then the functional shank is down and goes around the tooth. Since the 1112 is a universal explorer, the same end is used on the distal and then used on the facial surface and into the mesial. For correct use of the instrument, use a relaxed, light, modified pen grasp and establish a correct fulcrum. You will use the end 1 to 2 millimeters of the side tip of the Explorer and always keep it adapted to the tooth by rolling the instrument and pivoting on your fulcrum. Insert with light pressure as close as possible to the base of the sulcus at the distal line angle. Use multi-directional overlapping feather-like strokes that are longer than scaling strokes. No lateral pressure is used. Continue your strokes to the midline of the distal surface. Then come back to the distal line angle and proceed toward the mesial midline. Try to keep the end of the Explorer under the tissue with all strokes and go to the base of the sulcus with each stroke. Do not drag the Explorer. Continue for the next tooth. You are trying to feel the anatomy of the tooth. Feel for irregularities and for calculus. Make sure you roll the instrument and pivot on your fulcrum to keep the end adapted at all times to the tooth. Roll and pivot as you come into the mesial. To determine the correct end on anterior teeth, the correct end wraps in the direction you are going. And the last bend toward the tip tilts in toward the tooth. If it is the wrong end, the bend will stick out. For anterior teeth, you use one end for surfaces towards and then flip the instrument to use the other end for surfaces away. Use the same technique for instrumentation as in the posterior, but you will start at the midline of the tooth and insert. Use light assessment strokes and try to keep the end under the tissue while going to the base of the sulcus. Keep going until you cover the middle of the interproximal surface. Then you would go to the next tooth. After completing all surfaces towards or away, then flip ends and complete the opposite sides. Do short, overlapping strokes until you complete the interproximal surface. Okay. 17 Explorer for calculus detection. For the 17 Explorer, you will use the end 1 to 2 millimeters and keep it adapted to the tooth at all times as you roll and pivot around the tooth. This Explorer is used for calculus detection on anterior teeth only. Use a light grasp, exploratory assessment strokes with no lateral pressure, and go to the base of the sulcus. Try to keep the end of the Explorer under the tissue if possible. Explore with the end 1 to 2 millimeters and not the angle of the Explorer. Begin your strokes at the midline and continue to the middle of the interproximal surface. To cover the other half of the tooth, just turn the Explorer so the tip heads in the other direction and begin your strokes at the midline again. Continue to the middle of the interproximal surface. Then you would go to the next tooth. Continue around with short overlapping strokes and go to the midline of the interproximal surface. Roll and pivot to keep the lower 1/3 adapted. We have now completed a review of Explorers for calculus detection.